some incidents in life which seem insignificant, but they change your life.
It must have taken much time for anyone to realize that this is my limitation.
It's so strange when my wife sees me skin an apple or something, she said, how can you be a surgeon? You can't do that. That's what really changed my life. Whatever I am today is, a lot of it is because of my teachers and my training in PGI Chandigarh. The line from a beginner to an expert is small, but from an expert to a master is very long. I became known as a surgeon for complications.
Many surgeons today have developed a God complex.
This guy is funny. How can he say that? Do you understand what I'm saying? A bad resident will say, okay, let's manage it. A good resident say, no, there must be a way out to fix it. So these are lessons in life. If you badly want a thing, mostly it happens.
Hello, I'm in the august presence of one outspoken, maverick, magnetic personality, Dr.Adarsh Choudhary, who is the professor and head of Department of GI Surgery and GI Oncology at Medanta, and is someone who calls a spade. And also with me is Vinayak Rengan, is another young, energetic chap from Chennai, and we'll be chit-chatting with Dr. Adarsh Choudhary for the next couple of minutes. Thank you, sir, for being with us.
Pleasure.
And,
it's a pleasure being with you.
Where are you from? Which town are you from?
I grew up in Simla. My schooling and my medical school was in Simla. So I come from the hills.
Why did you take up medicine as a career?
In my time, there were only two professions to take. Either it was engineering or medical profession. So I won't say I had any altruistic motives or something. So out of these two, I took medicine because there were only two choices we had.
Was it your choice or your parents' choice or peer pressure?
I'm very lucky. My parents were actually had quite a bit of detached attachment with me. They never interfered in any of my decisions in my life. So I take the credit and blame for choosing things myself. My parents generally agreed with whatever I said. So it was all I think I was following what other people were doing.
You enjoyed your stay during MBBS, or at any point of time you thought this course is not for me?
No, I was very happy to be in the medical school, and I must confess that my intellectual faculties were not so developed at that time to enjoy or not to enjoy something. I have always lived life on day-to-day basis. So I enjoyed my stay here, and I enjoy it much more now when I go back and reflect on my good times there. So I must say I was very lucky to be in a very good medical college. Teachers were very good, and fortunately we had less number of students in each class. We only had 60 students. So which I think is a great thing because each teacher knew us by name. Mm-hmm. So there was a lot of personal touch. Okay. And we had great teachers. So I was very lucky to have people who affected my thinking and the way I behaved myself. I had good role models as teachers.
So at what juncture you decided you should be a surgeon?
I did not actually decide myself. When I was in medical school, everybody used to tell me that I'll be a surgeon because possibly I was too straightforward and I was a sportsman, and maybe people thought that my personality is more like a surgeon. So I started believing what people told me. I didn't have any inner voice. I was more influenced by what people told me that I have to be a surgeon. And another small incident which affected my life to be a surgeon was when I was in the anatomy class one day. I was holding the kidney in my hand and my hand was shaking. And my anatomy demonstrator said, you can never be a surgeon. Mm-hmm. So that thing that never word stuck onto me, and maybe subconsciously was a sort of a stimulus for me because I wanted to prove that man wrong that I can be a surgeon.
Did you meet him sometime later?
No, I didn't. I never met him again. But I remember that very vividly. You know, we all have some incidents in life which seem insignificant, but they change your life.
They do.
Am I right?
Yeah.
Some things which are not relevant to the person who's involved with you, but to you, they go like a dart into your heart and affect you. So that was one moment when I decided I have to prove this man wrong. I won't say that was the overriding reason, but one of the cofactors which propelled me towards surgery.
Now, quite often people get influenced by an individual during their MBBS in the department of surgery, for instance.
No, I was not influenced by individuals. No, I was not influenced by individuals. I applied for a post-graduation to PGI Chandigarh because Medical College Simla didn't have a postgraduate course. So we had no choice. So we used to work very hard because the only option we had was to either get into All India Institute or PGI Chandigarh. So when I went to PGI Chandigarh, so I had a good rank in the entrance examination. And those days, two most highly rated specialities were internal medicine or general surgery. I never wanted to be a physician, so I chose to be a surgeon.
Why you didn't want to be a physician?
I won't be able to answer this question. To me, like I said, the people had told me that I look more like a surgeon, and so maybe those thoughts prevailed, and I must confess, my thinking was not so clear as other people are. In the PGI, during that consultation, they call you one by one according to numbers. As I was walking, I still was debating medicine or surgery, medicine or surgery. Suddenly, I saw the professor of surgery sitting there. His whole demeanor was different. His attitude was different. So I went, he said, "What do you want?" I said, "Surgery." So that's what it's like. And I don't believe that, some people are made surgeons, some people are made physicians. I think that's just a cliche. With hard work, with involvement, with interest, I think anybody can become a
there are
surgeon.
no born surgeons. I mean,
No, I don't believe it. I may be wrong. I don't think there are any born surgeons. I believe attitude, skills are all cultivated. To say that this person cannot be a surgeon, I think is a wrong statement. You have to be really interested in being one, and I see no reason if somebody who wants to be a surgeon cannot be a
I
surgeon.
think that will be very encouraging to the many of the thousands of viewers who are going to see this, because we have been constantly told you're clumsy, so you cannot be a surgeon. I think these things are being told to.
I mean, it's so strange. It's so strange when my wife sees me skin an apple or something. She said, "How can you be a surgeon? You can't do that." But they don't understand that these two things are different.
Right.
So there are no skill sets. I don't know. But what's the skill set of being a surgeon? So long as you can think straight, you want to do something, I see no reason why anybody cannot be a surgeon.
Now, how was your tenure in PGI Chandigarh?
My tenure in PGI was actually a life-changing experience for me. I realized in PGI that the only thing that makes you get ahead in life is hard work, and nothing else. PGI taught me discipline. PGI taught me the value of patient care. And the most important thing PGI taught me was that surgery is not a technical exercise. There is a lot of theory attached with surgery. When I went to PGI, there was a prevalent belief among students that you should never do a post-graduation in surgery in PGI because you don't get any hands-on experience. It's better to go to other hospitals where you get a lot of hands-on surgery. But I have no qualms in saying today, if you see the surgical field in India, it's totally dominated by people from PGI. Why? Because there we learned that patient care is 50% or less of that is technical. Other is how you select your patients, how you use your physiological knowledge, how you do post-operative care, which were very important in PGI. Another thing in PGI was there was a culture of excellence. The guy next to you was better than you. The guy next to him was better than him. And to my mind, when you're surrounded by excellence, nothing else is better than that. All discussions, day-to-day behavior, even when we were brushing teeth in the bathroom, we used to talk about surgery, medicine, or patient care. Because they had created an atmosphere like that, that you have to all the time think like that. There were people in PGI who entered the gates of PGI as a resident, stayed there for 6 years, and then went out of the gates, never went out to see the city. So that's the culture they generated, and to my mind, that's what really changed my life. Whatever I am today is, a lot of it is because of my teachers and my training in PGI Chandigarh.
Who were your teachers?
The surgery department had a galaxy of teachers, and everybody influenced in their own way. But my life was very greatly influenced by Dr. N.M. Gupta, who is a world-famous esophageal surgeon, a man of immense humility. He was so modest. When I went to Sloan Kettering, Professor Ginsberg once asked me, "Where are you from?" I said, "I'm from India." He said, "From where?" I said, I'm from North India. He said, do you know Professor N.M. Gupta? I said, I worked with him. He says, you're joking. I was very influenced by Dr. J.D. Wig also, who had immense capacity to work hard. Dr. Bose, his composure during surgery. So they were my teachers, my mentors. So I was greatly influenced by this surgery.
Now, what I keep hearing from youngsters when they're choosing a college, while they're joining MS General Surgery, what are our cutting chances?
I think that's one thing we have to learn, that to be successful, you cannot only be skill strong. The emphasis on only being skill strong is totally wrong. I sincerely believe surgery is not a technical science. It's totally a cerebral science. You may be the world's best technician if you do not know where to put your sutures, if you do not learn when not to operate, to learn how to think, how to group think, how to challenge your own decisions, how to learn from your mistakes. These things only make you surgeons. I have known so many people who are technically very good, but they invariably land up in problems because they believe that their technical proficiency can beat physiology, which never happens.
So a surgeon should spend a lot of time understanding medicine and physiology. Surgery is not for people who are just interested in cutting.
Absolutely. There's no discussion on that. I mean, if you are believing in that, then I think you haven't understood life. There's no discussion in that. There's no discussion. I mean, choosing, you know it better than me, choosing the right patient. A good cricketer is not one who has many strokes. There are many good cricketers who had many strokes, but they failed in their test careers. A good cricketer is one who has very few strokes, but he uses them very selectively. Virat Kohli doesn't have too many strokes, but he masters the strokes he knows. He knows in which condition, which stroke I have to play. So you have to match the trick to the terrain, and that only comes if you give a cerebral dimension to surgery. There is no discussion or debate on that.
Is this statement, sir, have a few strokes and master them, is this a statement which indicates that surgeons must subspecialize in a particular field of surgery, only then they can master a few strokes and then excel in them?
No, I did not say that. I don't mean it. What I'm saying is that your decisions are based on what you know, and you should learn what you know. I am not a believer that everybody should subspecialize. I don't believe in that. What I'm saying is, we made a mistake that we think one particular field of surgery is glamorous. All surgeries are glamorous. A hepatic resection is as glamorous as doing a good fistula in NO is glamorous. So you can make any field look glamorous, but you should be passionate about it, interested about it, and willing to learn. The biggest problem, our biggest obstacles to learning is what? Is our ego. That a master practices because he wants perfection. The line from a beginner to an expert is small, but from an expert to a master is very long. We forget that. We believe by attending a few workshops, attending a few sessions, we become masters or experts. There is no escalator to success. There is only a staircase. You have to take every stair gradually, and young surgeons make this mistake that they want to get to the top very fast. It's possible to be fast, but that speed comes with hard work and involvement, but not by jumping learning sessions.
So you, after doing MS General Surgery, did residency in PGI as well?
Yes, I did my house job, my MS and my senior residency from PGI. And then I joined GP Pant Hospital, where I started the Department of GI Surgery. And
Why did you choose GP Pant?
Because that was, by the time I finished my registrarship in PGI, I was very interested in gastrointestinal surgery, and at that time it was not a separate specialty. So GP Pant at that time in 1986 was one of the first departments of GI surgery in India, maybe after Chennai. There was no other department. And when I opted to be there, everybody told me that's the biggest mistake of my life, because they said you'll have no patients and you'll have no work, nobody will have patients to you, and your surgical career will be over. This is an interesting story of my life if you want to hear this. So the Department of GI Surgery was started in GP Pant, and we were allotted some 15 beds and 2 operation theaters. For 1.5, 2 months, there was not a single patient with us. Can you believe it? Because next door to GB Pant was Maulana Azad Medical College, and they did not like the idea of a department of GI surgery being started next to them. This is normal. I would have felt the same anyway. So for 1.5, 2 months, there was not a single patient with us. And the professor who was posted with me himself was not interested in staying back in GB Pant because he wanted to go back to Maulana Azad. So he made no efforts to get patients, and it was in his interest that this department should close down. So I was called by the director of GB Pant, and I still remember the department was started in July 86. In September I was called, and he said, if in next 1 or 2 months you don't have any patients, we'd have to close this department. For me it was very traumatic. I had decided to put my life into GI surgery, so I was new to Delhi. I had no friends, I knew nobody, and nobody was referring patients to me. So those days I had a scooter and I went to various hospitals in Delhi to refer patients to me. Nobody referred a patient. So one day I went to a hospital in Trans Jamna, and there I met a surgeon. I said, we need some patients. He said, we have no patients to refer to you. As I was going out, he said, we have a couple of patients of fecal fistula. Do you want me to transfer to you? I had no choice. I said, okay, shift the patient of fecal fistula to our department. So 2 patients of enteric perforation, one young boy, 18 years old, and one old man, were shifted to our department the next morning. Those days, getting a patient of fecal fistula was a taboo. They used to smell. We had no devices to manage their output. My professor was very angry with me as to why I bring those patients. Patients were put in a separate room, and I used to look at that young boy. His mother used to clean his stools with a newspaper. So when I went in the morning, there was a heap of newspapers with stools on his side. God has his own ways, and at that nearly one of those days, Hollister company came to India, and a young representative from Hollister came to me. I said, we have some devices to manage fecal fistula. I want you to use them. I said, I have no money. We have no money because we can't use. He said, I don't want any money. Give me some patients. I vividly remember that man wearing his crisp white shirt, which he rolled up at his sleeves. He brought a ileostomy bag. We had never seen it before. And he put it on that boy's abdomen. The next morning when I went to see that boy, the mother was sleeping and the boy was sleeping. That vision in my life is worth $10 million. To see a mother sleep and a child sleep with stools coming into the bag changed everything. This is how life is. The word spread in Delhi that if you have ever a complicated patient, refer to Adarsh Choudhary in GB Pant. I became a dumping ground for sick patients. In 1.5, 2 years, I may be the only surgeon in the world who had done hardly any surgery on a virgin abdomen. I was only doing reoperative surgery on fecal fistulas and things like that. And that changed my life. I became known as a surgeon for complications. The first bile duct injury occurred within 6 months of starting laparoscopic cholecystectomy in Delhi. I did that bile duct repair, and all bile duct repairs, I won't say all, most bile duct repairs in the north used to come to me, and I became famous as a surgeon for complications. So this is a lesson for young people, that you try to do things which nobody else is doing. I later learned I succeeded because I did which nobody else was doing. Nobody was doing complications. Nobody wanted to do fecal fistulas. No, everybody wanted to do routine, simple surgery. So these are lessons in life. If you badly want a thing, mostly it happens.
How did your department expand subsequently?
The department gradually people came, joined. We were very lucky. A lot of my success is because of the residents who came to work with us. The senior residents who came to work with us were phenomenal. They had amazing qualities. They were very hardworking. I don't remember a single resident who shirked work. Mistakes were made because they did not know it. It never happened that I had asked for them to do something, they didn't do it. We were nearly the same age. I was young, they were my age. But collectively, they did so much. The best spirit these boys had was that they always believed we will hand over an alive patient on our duty to the next guy. It's like a relay race that handing a. Those days we did not have a ICU. We managed our own ICU. Our knowledge was limited. There was no parenteral nutrition. There was no blood gas analysis. So a lot of things were improvised. We did that. But I owe all credit to all the senior residents who came with me. They were phenomenal. They inspired me. We improvised a lot of things. We made mistakes, but we learned from them. And soon we became one of the leading departments of GI surgery in the country.
And your residents are all doing well now, sir?
Extremely well. Extremely well. I'm very proud of them. If I name one, they'll be wrong, but most of them are doing extremely well. And there is no reason why they shouldn't do well. If you work hard, if you learn, if you read, your intentions are right, and your value strong. Skill strong is easy. Value strong is difficult. Most of them are doing extremely well. And one of my qualities, I don't have many qualities. One of my qualities is I can spot talent. I played a game with myself, and I still play it. When residents come to work with me, within 6 months or so, I lay a bet with myself whether this guy is going to be successful or not. I'm right 95% of times. Successful people have some qualities.
And what are those qualities? So that others can emulate them and...
There is no rocket science. I think the biggest quality of a successful person is persistence. They don't give up. I mean, if a person has a fecal fistula and the bag comes out, a bad resident will say, okay, let's manage it. A good resident say, no, there must be a way out to fix it. I have to improvise something to fix it. Why is this guy not looking well? When I was a resident in PGI, my boss was Dr. B.L. Talwar. He will come to the ward, and many times he'll come and look at a patient and say, this guy is not looking well, get an X-ray done. Those were days we didn't have a CT scan or an ultrasound. And he used to think this guy is funny. How can he say that looking at a patient? He hasn't touched a patient. And we used to get an investigation, and majority of things, something was amiss. He had developed the sixth and seventh sense to look at a patient and see. If you look carefully, I've realized in my life, patients are rarely wrong. I myself made mistakes when patients say, I've got pain. I said, no, all is well, it's just psychological. Patients are not wrong. There is always a window of opportunity which closes with rapidity. If you don't act in that time, you lose patience. Once you learn to sense that, to see the unsaid, to see that something is amiss, the patient's trajectory recovery is not normal. People who are successful, they notice these things. Successful people see patterns. They see patterns. You see how chess players think. If you show a chess person a game, you show him 6 games and ask him to reproduce these games in the evening, a chess master will memorize all those 6 games and tell you, right? But if you show him 6 chess boards with random things, they won't remember it. So you have to learn to remember patterns. That a laparoscopic cholecystectomy patient next morning has to be sitting up, reading a newspaper here to go home. If he's lying in bed, this patient mandates an ultrasound or a leukocytic count. If a Whipple's patient on 3rd day has tachycardia, the enzymes are not normal, urine output is falling, it is stupid to think that he has some cardiac event. This is a leak. So once you develop this understanding, your thinking becomes contextual to a patient. And this is not teaching. This is knowledge comes that wisdom lingers. You need to get wisdom. And that doesn't come overnight. That only comes to people who want to do it. You see in the same class of 60 students, some students get gold medal, others fail. Same classroom, same teacher, same atmosphere, same books. Why does it happen? It is how much we take from it.
You have seen thousands of complications of various surgeons, sir. And you must have seen some patterns in them. Some surgeons having a little more higher complication rate and some surgeons having a lesser complication rate. What do you think causes complications? What attitudes in a surgeon, what can a surgeon remove from himself so that his complication rates decrease?
To say that I'm an expert on that is not true. I have created myself complications. But first thing is to first accept that majority of complications are iatrogenic and avoidable. When you do not recognize this, you want to blame your complications on something else, you'll never learn. Do you understand what I'm saying?
Yes.
You always blame something else is there. I tell you an incident. Couple of years back in our department, we did 2 or 3 hemicolectomies and all 3 of them leaked. One after the other. So it was a great concern that 1 leak is all right, 3 occurring, something's amiss. So we sat down and discussed what's going wrong. Some of my colleagues said, no, we are getting older patients, they are sicker patients and these things have run. It's very easy to accept it, sick patients. But that's not the way it happens. We have the same atmosphere, same population. What has changed? Somebody said these staplers are of the wrong type, maybe the stapler malfunction. I believe staplers don't malfunction. They're very nicely tested. Something is amiss. So I sat down, I thought of it, I found various things, and one of the things I finally zeroed on was possibly we had become very careless. We'll just fire a stapler fast, bring it out and open it. Before the staplers could form, because once you are successful 100, 200 operations, you think you are a master, you get complacent. So I told the rule, now no stapler will be taken out in less than 3 minutes. We put it, we wait a minute, we fire it, we wait a minute, we bring it out. That's it. So we thought of it. So I think most mistakes occur because we do not accept that we made a mistake. Once you learn to understand that it's possible, and the worst thing you can have is a surgeon with an optimism bias. Optimism is lethal for a surgeon when he's operating. When you talk of patient outcomes for cancer surgery, I'm not talking about that. If you're operating, you don't take care and say, oh no, God willing, everything will be all right. You're mistaken. God hates surgeons. You make a mistake, you'll have to pay for it. So you devise things which are no things. We will never do it. We will never fire a stapler unless we have done a per-vaginal examination, seen that the vagina is not incorporated. We will not fire a suture unless we see the ureter is there. We will not do this. We will not put a stapler on the right hepatic vein unless we can see both jaws of the stapler. So there have to be no events. We will not do it. Till you don't do it, you form rules, follow them, always demonstrate them. I think the incidence of complications can be decreased.
So a surgeon has to set his rules and live by them.
Absolutely. Live and show it. You have to walk the talk and do that. Because you've seen yourself that in our line, failure is not an option we have. If you come to our operation theatre, there's a very small slip there which says 50, 50, 90. Which means that any time you think there's a 50% chance of a complication occurring, it'll occur 90% times. So most complications, obviously some complications will occur, but most are avoidable. There's a particular mindset at a particular time, then you know that you lose attention in that minute and it happens. There are surgeons whose attention span is only for 1.5 hours. They try to do surgery for 9 hours, problem will start. So you need to define, you need to know your handicaps. You need to know, you are not all of us are not Formula 1 drivers. Some of us will drive on a safe road, some of us can drive on a hilly terrain, some of us can be Formula 1 drivers. Problem is, when you know that you are not a Formula 1 racer, don't go to that race. Right? I don't do laparoscopic colectomy. I don't know how to do it. So that's not my team, but a person who's better than me in my department does it. I'm good at what I do. I have my strengths, but I also know my limitations.
It must have taken much time for anyone to realize that this is my limitation.
The earlier you realize it, the better it is. If you want to be successful, you will realize it earlier. Success is not making money. The success, in my language, success to mind is the ability to express your skills and your desires in what you're doing.
So how long was your tenure in Pant, GP Pant?
I worked in GB Pant for 17 years.
That's pretty long.
Yes, I worked for 17 years. It was one of the most satisfying, gratifying, and academically useful experience for me. I believe very few surgeons in the world would have done more surgery that I did that age. There was so much to do, and I did so much. I published so much because there was so much to do, and it was one of the most satisfying experiences for me.
This so much started from nothing.
Yes. It's always like that. It's always like that. We always think that the world is unfair. Yes, the world is unfair to a point. But eventually I believe that, I'm not saying I'm good or great, but eventually I believe one of the strongest forces in the world is the power of intention. If your intentions are good, things fall into place. They might take time, but eventually they fall into place. You have an intention, you are doing all this. There's a purpose behind it. There's a thought behind it. If everything in life is transactional, that what will I benefit from this, what will I get, then things don't work. You have to sometimes follow the calling of your heart, that I want to do it no matter how it benefits me, but I want to do it. It might benefit somebody else.
That burning desire to achieve and...
Yeah. And nobody can give it to you. It comes from, it's innate, it's in you. How do you get it? I don't know. I'm not saying I have it, but I've seen people like you who have that fire, who do it. But I don't know how you get it, what inspires it, I don't know. But people with fire will do it.
Now you had a very, very successful career in the public sector. Were you thinking of what will I do post-retirement, or will I continue to work, or whether I'll translate my popularity into a private sector sometime? Have you ever thought of it?
No, I've never thought of it. I am not a great thinker in that way. I've lived by what Herman Hesse once said, that life is lived in moments, not eternity.
And why and when did you leave Pant, sir?
I left Pant in 2003. I left Pant in 2003 for the reasons very simple. It was becoming difficult for me to work there. Because what had happened was there were a lot of bureaucratic hassles which were impeding my work. I was wasting a lot of my time in useless meetings and inquiries, which to my mind were kind of intellectually crippling to me, and they were not contributing to my success, or they were affecting my intellectual and academic pursuits. So a lot of my time was consumed in that. So I was no longer a master of my time. So I never wanted to leave government sector, but I had to leave because I was realizing I was not doing justice to my time, nor I was being able to do justice to the patients for whom I worked. A lot of my time was spending on going to the ministry and to the secretariat for some meetings which I think were absolutely a waste of time, and I was not skilled to manage.
Now from Gangaram, or rather from GB Pant, you moved to Gangaram.
From GB Pant, I moved to Gangaram, and Gangaram.
Why Gangaram?
Because Gangaram offered me a position, and they were very, very supportive. Dr. K.C. Mahajan was a great visionary. I have a lot of respect for him, an amazing man, an amazing surgeon, and somebody I look up to because he had a big heart, and he loved surgery, and he told me to join, and he gave me all facilities, and I joined Gangaram, and I worked in Gangaram from 2003 to 2010, and then I moved to Medanta, and the reason was that not because anything was wrong in Gangaram. The problem with Gangaram was that I could not grow from Gangaram. They had limited beds, they had limited operation theaters, and my work was growing very fast. In Gangaram, I had 6 beds only. I had only 3 operation theaters tables in a week, which could not manage my work. So I shifted to Medanta, where now I have 4 tables every day, and I have close to 70 beds, so I could grow. That was the reason for it.
The common thing which I had noticed is not all individuals who done well in the public sector do well in private sector. For that matter, a large number cannot, because first of all, these patients will not follow you in the private sector, the ones in the government sector. And two is, to start with, there will not be any patients in the private sector.
I didn't experience that. A lot of people ask me this question. I am the same person. People say, do you have to spend more time with your patients? I'm not trying to be somebody extra. I'm just the same. I never had the problem. The first day I shifted to Gangaram, the next day I did a Whipple's procedure. So it never happened with me. So I will not be able to answer this question.
Is it that the patients followed you from?
Yeah, a lot of my patients followed me, and I feel very proud in saying that a lot of my patients from GB Pant days are still following me in Medanta, where I'm going. They come for follow-up, and that's possibly because of my nature. I'm very friendly to my patients, and they can probably correlate with me, and I never had that problem. Patients follow me, and I never had that problem on that. I never had that problem.
We find that many residents, young surgeons, especially in the public sector, are quite rude to the patients. And what is the reason for that? Is there a seismic shift in the way residents these days are thinking, or is it that the value of the patients' lives has decreased in the minds of surgeons, or is it because that many surgeons today have developed a God complex where they think that they are at a much higher pedestal than their patients?
Yes, you are right. I think it's part of our culture. I feel very sad in saying that we have tremendous erosion of culture in this country. We have people who have very poor set of etiquettes. As a teacher, when I'm in Medanta, I feel it's my responsibility not only to teach people surgery, but also to teach how they dress up, how they talk, how they walk. Because we are role models. Patients look up to us. Why do we have patients fighting with us in the emergency? Why are patients so unhappy with us? There can be other reasons also, but one of the reasons is the way we dress up, the way we talk. Doctors are very respected. If we talk the same thing, it costs the same amount of time to talk rudely or to talk politely. I understand, even I can get possibly rude at times, but I've realized it doesn't work. I'll tell you an incident which changed my life. I was in GB Pant and I was taking a round with my residents, and one young man came up to me and said, I want to talk to you. I said, can't you see I'm taking a round? You shouldn't disturb me. I was very rude to him. So I'll see you after the round. He stood on the side. I finished my round and I walked up to him and said, yeah, what's it? In a rude voice. He said, sir, you operated on my father 7 years back. He had a pancreatic cancer. He died last month. And when he died, he left this book for you. So he wanted me to give you this book. I was so embarrassed, ashamed. I could not look into the eye of that person. And that's when I realized I could have said the same thing very politely also. The same thing I could have told that man, I'm busy, can I see you later? So there are some incidents in life which change us. There are times when you are angry. There are times the best thing I tell my residents is that they're very worried. Some patient is bothering them. Instead of shouting at them, they can always say, look, I'm very hassled. I'm very busy. I will not be able to talk to you. Please excuse me. Once I'm done, I'll come back to you. The same words you say it rudely, it creates an incident. I think it's a part of me and other teachers to teach our juniors, because this younger generation has come up in a jet set age. The way I used to talk to my father and the way children talk to me is totally different. Things have changed, but patients are different from normal individuals. They are suffering, their expectations are different. We need a degree of empathy. So I think we need to train ourselves into the art of communication and try to soften up and say same things in a different way.
Doctor to patient interaction, you have spoken in quite amount of detail how we should behave. Surgeon to surgeon interaction, you see surgeons who have made complications when they come to you. How do you deal with them?
Many surgeons don't come. The worst surgeons, I feel very embarrassed. I can't tell them on the phone. It's very embarrassing when a surgeon calls you up and says, you know, this patient was undergoing a laparoscopic cholecystectomy and my junior did it and he damaged the bile duct. That is the worst thing to say, because the patient came to you. You were responsible for it. If you gave it to your junior resident, it's your responsibility. You cannot be absolved of this responsibility. We all create complications. We all learn from them. I mean, once you accept that a complication has occurred, it's okay. To me, it's very traumatic. Then I can't say it on people's face that you need to accept a complication. I always discuss with surgeons. There are some surgeons who are very nice. Most people are very nice. They say we made this complication. They come with the patient. They understand and they learn from it. And that's the way what we need to do it. And as a surgeon, the worst thing to do is the blame game. That why did you do that? Many patients who get a complication, they ask me, did my surgeon make a mistake? I always say, it's so easy to be wise in retrospect. Given that scenario, it's so difficult to decide. Mistakes can happen, complications can happen, there are known complications. So it's not about complications that are an issue, it's the way how we manage those complications, that's an issue of concern.
So in the private sector, do you find it difficult to give your residents the opportunity to operate because there are limitations?
No, I don't agree with you at all. All the amount of surgery residents do is just the same, because even when I was in GB Pant, I always believed that I have to stand on the other side. I have to stand on the other. If I'm not there, another person who's as competent as me on the other side. We should never leave anybody unattended. We should not leave anybody unattended, even if that person is not scrubbed up, is in the operation theatre. So the amount of surgery which is done by our DNB candidates may be more than the surgery which is done by people in government sector, because the amount of surgery we do is much more than is being done in government sector.
And that's a very commendable fact.
No, it's not commendable. I mean, it's unfair to leave anybody unattended. How will you teach them? If I do a Whipple's procedure today at this age, I don't do the entire Whipple's myself. There's a certain point I join. Somebody does before that, it's a graded responsibility. It's not that you suddenly leave a patient with somebody. I've seen institutes, some hospitals, I'm very sad to say, at night the seniors don't come. In some government hospitals, and some only senior residents decide what operative surgery has to be done. This is not done. It's a question of somebody's life. We have to be answerable, we have to be responsible for that.
In 90s, I remember early 90s, used to read in B.B. Dixit library. Did you segregate some time for reading every day?
Yes.
Even now?
Even now.
What is the timing?
Yes, I have believed that my biggest force, maybe anybody's bigger force, is the power of knowledge. If I read, I know better. In this battle, I am more well equipped, I'm more well armed. So I think reading is essential, and I also emphasize that we as doctors, as surgeons, should do a lot of non-medical reading also. I believe I've become a better person, a better surgeon by reading about thinking, about decision making, about biases, about analysis of information. All these things help you become a better surgeon. The problem with our training and teaching system is, since you're involved in teaching, I will discuss it with you, is that in the taxonomy of learning, remembering is the lowest. In this country, we have always emphasized learning and learning and learning. Next to learning is analysis. Analysis rates higher than learning. We must learn to analyze what is sense, what is science, what is pseudoscience, what is sense, what is nonsense. We have not been taught. In my department, there's a journal club, and somebody presents the journal club and he defends his article. I many times tell him, you are not the author of this journal. You need to criticize this article. You have not done this bit. It is because we haven't trained people to analyze. And the highest form of learning is creativity. So you have remembering, you have analysis, and you have creativity. Creativity in our country is nil. Analysis very little. All our emphasis today is on remembering, which we need to change.
Is it an inherent dependence on the hierarchy system, which is prevalent in a country for thousands of years, which has created an environment where criticism is not accepted and criticism cannot be constructively accepted by seniors also.
Yes, you have said it very well. It has been an Eastern thing that if somebody disagrees with you, it is indiscipline. Disagreement should be encouraged. Unfortunately, most people at certain stages of their life believe that their word is the last word. Those departments never progress. Disagreement is a very pleasant thing. Disagreement intellectually, discussing wise, not for the sake of disagreeing. Constructive disagreement, we all work towards a patient's life for doing well. And I think questioning somebody, discussing, always helps patients. Many times on the operation table, a second assistant gives me a better advice, because sometimes as surgeons, our judgment gets clouded by narrow thinking. I have a preconceived notion, and preconceived notions are the biggest locks to doors of wisdom. If somebody suggests, you may not follow, but at least listen to him. If you don't listen to your juniors in a discussion, they'll stop suggesting. Never ridicule anybody's advice. Never ridicule anybody's suggestion. I'll tell you how things are chromatic. In early 1990s, there was a gastroenterology conference somewhere, Indian Society of Gastroenterology. I better not mention the place. And by that time, like I said, because we used to get patients of complications, I had done about 20-25 necrosectomies. Nobody else had done so far, because we were getting patients of acute pancreatitis. And they were discussing, some people on the dais were discussing on acute pancreatitis. And I was a young boy in the audience. And then I asked a question, what do you think about pancreatic necrosis? And one very leading surgeon at that time snubbed me and said, there's nothing like pancreatic necrosis, and sit down. So that day I felt very bad that I've been snubbed down. I know about it and it happens. I felt very bad that day. From that day onwards, whenever I am on the dais now and a young boy gets up to ask a question, I never snub him down. So I always say, you may be right, there might be a point, but there isn't enough evidence on that. So always when you get mature, you get senior, you must encourage people to talk. No question is stupid. Some answers are stupid, of course. No question is stupid. Let people ask questions. So if we don't encourage people to disagree, to think, to analyze, we just stop their thinking. We stop creativity. We stop ideas.
Sir, you were one of the pioneers in GI surgery in this country, and in the northern part of the country, you were one of the biggest names in GI surgery. You still are. And you learned and practiced in the open era initially, and GI surgery has been constantly evolving. Laparoscopy, robotics, image-guided surgery. And right now you are at one of the most technologically advanced places in Medanta. And how have you efficiently adapted to the changes? What inherent nature allowed you to adapt to these changes?
It is very simple. I've realized I am not the fulcrum on which everything moves. There are people who are better than me. My younger colleagues are better than me. As an individual, no department, no organization will grow, teams will grow. My team does much better laparoscopic surgery, bariatric surgery, robotic surgery than me. So I have people who are more competent than me who are doing these surgeries. So my aim as a leader is to make people grow. Knowledge should be centrifugal. Success should be centrifugal. It should not be centripetal. My age is the age of minimalism. I must give now. I must give opportunities. I must give people new platforms to succeed. I must give people avenues to do better. I must give them ideas that they should do things, and they are doing it. We currently do close to 250 cases a month. It's not possible for me as an individual to do it. These cases happen because there are people with me who are much better surgeons than me. But you need to be able to work in a team. The problem with surgeons is that we have egos, we cannot work in teams. We always think of my ego, that I am the best. We need to understand that excellence is not a monopoly. If I can be good, you can also be good. The problem is acceptance of this fact is the biggest malady that surgeons have. We run races which don't exist. There are 10 people who can be best surgeons. Why do I always have to be correct? I don't want to be always correct. It's impossible. Some of us have this problem. They always want to be correct. I don't want to be correct all the time. I cannot be. But yes, I want to satisfy my curiosity by asking a question, and you have all right to disagree with me and educate me, and I'm willing to learn. The problem with us is that before the other guy has stopped speaking, we have already decided what we are going to say. So you have already formulated a thing and you haven't understood what that person is saying. Our mind is already made. I asked Murray Brennan, who is one of my greatest role models. Murray Brennan was the chairman of surgery in Sloan Kettering. He came to Medanta. I asked him, what do you think about laparoscopic whipples? He says, I can't do it. He asked me, can you do it? I said, I don't do it. I said, can you get a good retroperitoneal margin in a big cancer? He said, I don't know. He could have said, no, it's not possible. He says, I don't know. I'm sure there are people who can do it. See, the ability to give credit to people, to say, I meet a lot of youngsters every day in meetings, and they come up to me and say, sir, I've done 2 laparoscopic whipples. I said, that's great, but why did you do it? He said, sir, everybody's doing it. What a poor argument to do it. Because everybody is doing it, you want to jump on the bandwagon. If they would have said, sir, I believe patients are discharged early, there's less pain, less scar, things like that. An argument because everybody else is doing is a very poor scientific argument.
You are a live wire wherever you are, whichever meeting you are, fully energetic and fully attentive to what's going on. And then you are a very fit individual. What goes behind all that? In other words, what is your daily schedule?
I don't know what goes behind it. I have only one law in life. Either I'm involved or I'm not involved. To me, there is no second way about it. There is nothing lukewarm about it. Either I'm involved in it or I'm not there. So does it make sense?
Yes.
So, I feel very surprised when people are in a conference and they say, let's go out and say, I said, either you're here or you're not there. So I make no pretensions. If I like something, I will say it. If I don't like it, I will say it. And I also know that people are mature enough to not to judge me on that. So we have the right to express what we see. Whether you like it or not, it's your problem.
How do you handle egos? You have some of the best people working for you. A group of committed, extremely brilliant surgeons. How do you act as the gel? How do you act as a sage among a group of brilliant surgeons?
I don't think I act as a sage or something. I think I have to first mend myself. If I don't have an ego, other people see me and they come to me with the problem. I have fortunately not experienced it, but people who experience it, they can't say, then they will leave. But fortunately, nobody has left us so far. People have stayed there. People are left for other reasons. But I think most human beings understand that ego and anger are 2 most futile emotions. They don't take you anywhere. The earlier you learn it, the better it is.
On that note, thank you so much, sir, for spending time with us.
Thank you so much.
There's so much wisdom you have given us, and then
I have just merely told you what I've lived. You say it wisdom, you say tricks of the game, there's nothing else that. We had a surgeon from Saudi Arabia. I met him in a meeting and he said, I want to learn the tricks of pancreatic surgery. I said, there are no tricks. He said, no, there are tricks of the trade. I said, I can teach the trade. Tricks I don't know. So he came when I was in Gangaram and he stayed in a 5-star hotel and he took a car and he used to come to the operation theater and see my whipples and go back. 2 years later, I met him in a conference somewhere overseas and I met him and asked him, oh, how are you? How's your pancreatic surgery? He said, it's no good. All my patients are dying because Indian patients are better than our patients. I said, how is it possible? You are a rich country. Or what does your patients die? He said, no, all pancreatic surgery I did, patients have died. That's what I wanted to tell him at that time. You never wanted to learn the trade. You wanted to learn the tricks of the trade. You never saw the patients before surgery, after surgery. You only came to the operation theater and learned. So same way, I have no wisdom. I lived a life and I've been very lucky. I've experienced, and yes, I've learned from those experiences. Some of us keep making the same mistakes and call it experience. But I have fortunately learned from my experiences. And thank you very much for giving me an opportunity to express myself to you. Thank you very much.
Thank you, sir. Thank you so much.
Thank you.